Normality, as it was before, will not come back until we get a vaccine.
It haunts me a little bit because you can't ever get it just right.
Why am I not able to go back to school?
Why can't we go outside and play with friends anymore? Why can't I hug my grandma anymore?
The issue for a lot of Canadians is that they have no savings. They live paycheck to paycheck.
Everyone stops going outside their house, transmission will slow considerably. The problem is you can't sustain that indefinitely.
It just makes you feel like you're doing something to help.
Hello, I'm Dawna Friesen. Thanks for joining us. I know we're surrounded by uncertainty. It feels like everything is changing. There's a virus lurking. People are dying. We have to stay physically distant from the ones we love. And everyone wants to know, is this the new reality? Well, no one has the answer right now. But every week in this program, we're going to keep asking. And we hope to uplift you a bit too, maybe even make you laugh as we all find our way through this. Leading the charge are the public health officers. Teresa Tam is the federal officer, and each province and territory has their own. They never seek the limelight. Now, though, they are some of the most famous and beloved leaders in the country. Their daily briefings are where Canadians turn to get the facts and learn about the science. BC's public health officer, Dr Bonnie Henry, is so beloved, she's inspired a fan club, T-shirts, street art, and musical tributes. She's also keenly aware that this virus came out of nowhere, and that makes it very hard to predict where it's going. Dr. Henry, I know you are so incredibly busy. Thank you for taking the time to talk to us. You know, I want to start by asking, when we watched what happened in China and saw what this virus is capable of back in January, how it overwhelmed the hospitals, that it killed even healthcare workers, entire cities were put under lockdown. Did you think what was happening there could happen here? Do you have a, forgive me, but a kind of holy crap moment?
Absolutely, and I think in talking about it with my colleagues, to the media, to the public at the time, we were holding out hope that China would be able to contain this. But it became apparent not long after. I mean, I knew we would undoubtedly have cases in Canada and in BC, just given the travel patterns that we knew around the world. I don't think I was prepared for how severe it was going to be in other countries, particularly when it hit Europe. And many of us, I think, around the world, when we saw what was happening in Italy, was really shocking. These were all the things that we had talked about in preparing for pandemics for a long time, but I never really thought that I would actually have to do them. But I think, here in Canada, we had the luxury of time to prepare us and to help us understand what things needed to be done.
You have so much experience with the SARS outbreak in Toronto, where you helped lead the response, and the Ebola outbreak in Uganda. Those were life and death challenges too. How does what you're doing now compare to that?
I think every pandemic is different. Every outbreak is different. All of them have their challenges. This one certainly is unprecedented in the impacts that it's had around the world. And, as you say, I've been involved with many very serious, very tragic outbreaks. And this one, the whole societal impacts of it have been immense.
You have such a fine balance to keep as a public health officer, informing people but not panicking people, deciding when an ask becomes an order. It's critical that you keep the public on your side throughout this. How much does that weigh on you?
A lot of it weighs on me. It weighs on me, we want to put in enough restrictions to do what we need to do to contain this virus. Right now we know there's no treatment, there's no prevention if you've been exposed. We just need to make sure that we can care for you appropriately and that we do everything we can so you don't pass it on to somebody else. but every single measure that we take, the unintended consequences, the numbers of people who have had their lives disrupted, whether it's from COVID-19 and the tragedies in our long-term care homes, or whether it's people who've had their surgeries cancelled, or people who are unemployed because of the huge economic fallout. I think everything about this has been so challenging, and the sort of balance of trying to get just enough restriction to do what we need to do, but not too much. And it haunts me a little bit, because you can't ever get it just right. Though there is widespread transmission in some areas of the world, we are not in that position yet.
I know you are a doctor, Dr. Henry, not a TV personality. Your briefings have happened almost every day, though, for 12 weeks now. You've become must-see TV in British Columbia. People are drawing pictures of you and murals of you. I'm sure they're sending you things, and they're writing songs about you.
Dr. Bonnie Henry, we're in love with you.
That's a barbershop quartet in Nanaimo. They love you. It's pretty remarkable, isn't it?
Can you see me blushing?
We're in love with you.
That was beautiful. They certainly have amazing voices.
I guess what I'm asking is, what do you think it says about how the public is looking to people like you, to public health officers and to experts and to science to lead us out of this?
Well, I am heartened that people are looking to experts and to science, particularly in Canada. And, I've said this many times. What I do is I'm the face and sometimes the voice of a lot of people, and a lot of people who are very committed and passionate and doing the work on the ground. And we are a team. And we are a team across the country. We know each other well. We talk all the time, sometimes daily these days. But it is a privilege and very humbling for me to represent the work that so many people are doing to try and keep us safe in our communities across this country.
The million-dollar question is when this will end. Now, I know there's no precise answer to that. I'm not going to ask you that. But what about an exit strategy, a plan for a ladder, if you like, that we can start climbing to get out of this? You must be working on that.
Absolutely. And in the same way that we were watching China, we were watching Italy, we were watching Singapore, Hong Kong, Germany, we're now watching them and seeing where, in some ways, again, we have the luxury of everybody else going before us. Right now, of course, we are still very much in the middle of things in the United States and across Canada. But we are seeing what measures others are doing and how it works. So clearly watching Wuhan very closely, where they've just lifted restrictions quite a lot. And we have the luxury of some modeling. We have some really brilliant minds that have been looking at this, looking at what we might think of over time. And yes, we are planning from the very first day we put the first measures in place. My goal, my aim, and our direction to people was, all right, what do we need to know that we're in a place where we can stop doing some of these things? I think the reality is that some things are going to change for a long time, maybe 18 months, maybe years. Things around distancing, things around cleaning our hands regularly, the things that do protect us, that safe distance between us. Until we have a herd immunity or community immunity, whether that's because people have been infected or hopefully because we have a vaccine that prevents us from getting sick with this virus, we're going to have to do some things for quite some time.
When is it time, Dr. Henry, to tell the public what that strategy is, how it will work when some of the restrictions can be lifted, and how that will happen?
None of us are in the place right now where we can consider how we're going to lift restrictions. That doesn't mean we aren't thinking about it, and we need to think about it, but we need to be realistic about the fact that we have a few more weeks before we can start actually implementing these things, and we'll talk more about what that looks like in the near future. But right now it has to be done in a very thoughtful way, and a way that makes sure that we have those surveillance pieces in place so we know know if we're starting to get more cases again that might lead to outbreaks and overwhelm our health system. So it's going to be a fine balance for a while.
You know, we sometimes talk about the cases and the deaths as if they are statistics. They are, of course, and we all know they're individual people. You are making life and death decisions. There must be times when that really hits you.
Absolutely. And, you know, it's the thing that keeps me up awake at night more than anything is, you know, have we missed things? What have we done enough in this area or that area? You know, the tragedies of you know, recently we've had people who've died from this at home. What can we do differently? How can we support people? And the other part of it that's so important is these measures, these unprecedented measures we've put in place across the world. You know, the impact on children, the impact on people who can't, who haven't been able to get their surgery that they need. It's been, it's very challenging to reconcile all of those, and of course everybody who dies from this, who's affected by this, their family, their caregivers, their community. But I also think, you know, that's what that is why people are willing and able and are doing what we've asked them to do around social distancing, around keeping that safe distance for people, staying close to their family, working from home, because we know that if we get sick with this, it is our loved ones, our family, and our close community that we're going to pass it to. So all of us are in this together, and I think, you know, that's the impetus so many of us have to make sure we're doing the right things.
Coming up, from family gatherings
Why can't I hug my grandma anymore?
to play dates,
How many minutes are we going to be home?
answers to the questions our kids are asking, and
We certainly are coping. I think we've created a lot of capacity.
how frontline workers are taking care of COVID patients and themselves, and
Canada's done pretty well. We could have done better.
what we've learned so far, and the new test that could get some of us back to work.
One of the things this virus has shown us is that there are limits to our medical and scientific knowledge. The novel coronavirus is moving faster than the world's best scientists. In Canada and around the world, they are toiling away in labs, doing the painstaking work of creating a vaccine and working to ramp up testing to find out who is infected and who might be immune. Never has the world been so focused on testing, and never has there been so much attention on the people who develop, administer, and analyze those tests.
Canada's done pretty well. We could have done better. I would have liked to have seen more testing early on to get a better sense of where we were. There's no doubt that early testing and contact tracing, finding those original cases, can have a big impact on the eventual spread because you're stopping it from spreading early on.
Dr. Michael Gardam was one of the leading figures in the fight against SARS in 2003.
Oh yeah, it's very different. I mean, in SARS, the technology wasn't nearly as advanced, right? So we weren't testing the general public at all for SARS. We were only testing people in hospitals who had compatible symptoms. And even then, we weren't doing it until the second half because we didn't even know what SARS was for the first half. So this has been very different. There was no community testing at all for SARS.
When those on the front lines talk about the importance of testing, they're actually talking about different tests, all of which could be key to reopening the world. The first is the antigen test, processed methodically in a lab. It tells us who is infected right now and could pass it on to others. The antigen test involves poking a long swab deep into the nose to just above the nasopharynx and rotating it. The goal is to collect microscopic material that's recently been in the lungs, which is where the virus is believed to replicate. The swab goes into a vial and is sent to a lab. We know there still aren't enough test kits or labs to test everyone.
That's really going to be one of our main strategies to get us out of the mess we're in right now, which is if you can have easy access to a test, even if you've got mild symptoms, if you're positive, then we know to tell you to go home and isolate for 14 days. And we can also tell your contacts to be wary for symptoms. If we can do all that, then we're much more like what South Korea has done from the very beginning, which is a lot of testing and really doing a lot of contact tracing. And they've been able to keep a lid on this pretty much better than almost any other country.
There are more rapid tests on the way. Health Canada is analyzing a portable rapid test made by Spartan Bioscience. It uses a throat swab, and in a device about the size of a coffee cup, it's said to deliver results in minutes. In the U.S., the FDA has approved a rapid test, too, made by Abbott Laboratories. It also claims to deliver results in minutes. It's being used by the White House, but there are concerns about accuracy and scaling it up for wider use. In addition to diagnosing patients, there's another kind of test that's being developed and scrutinized in Canada. This one is a blood test for antibodies, which reveals whether you've had the virus in the past, possibly without symptoms, and are now potentially immune. Health Canada plans to test it first in healthcare workers and select populations. Once approved, it could allow you to safely return to work. And the more people that are in that category, the more the economic engine can start revving again.
So I think I do see this as a sort of the light at the end of the tunnel, which I know has been used by many people in terms of how do we actually forge a path back to what life used to be.
Jim Woodgett is Director of Research at Mount Sinai Hospital in Toronto. The team there is developing a new and faster blood test to detect antibodies.
And the important thing is to try to identify, as people have the virus and recover from it, a lot of people actually don't even know, or they have very mild symptoms, and so they're actually immunized against the virus.
But, and it's a big but, it is not yet 100% certain people with antibodies will be immune, or how long immunity would last. The virus could mutate, so the optimism is an educated guess right now.
Absolutely. The more data points we get, the more accurate a model becomes.
Dr. Craig Jenny is an epidemiologist at the University of Calgary. He says the antibody test could help in the development of a vaccine, but the reality is a vaccine could still be a year to 18 months or longer away. Until then, we could be confined to our bubbles. Physical distancing remains the most effective way to slow the spread.
I honestly don't know if we're out of the woods until we have either a therapy or a vaccine. Because even if we get the numbers down so that there's no community spread, for example, in Canada, as soon as we return to normal life, open the borders back up, if there's other hotspots around the world, it's going to come back.
It's possible the virus could, in several months, be contained enough to start relaxing some restrictions on our lives. For now, the restaurants, theaters, malls, and countless businesses will stay dark as we wait for the doctors, researchers, scientists, and public health experts to lead us back into the light. With me now is Dr. Tasleem Nimji. She's Director of Medical Innovation at Humber River Hospital in Toronto. Dr. Nimji, thank you so much for all you do and for joining us. You've been treating patients with COVID-19. You're on the front lines of this. We've heard Canadian hospitals are still coping, have not been overwhelmed. What's it been like for you?
I think that's fair to say. We certainly are coping. I think we've created a lot of capacity in the system that's helped us certainly in terms of dealing with the traffic now coming into the system. And in addition, I think certainly we can see when we're looking at our numbers and doing our modeling, the efforts that we have in the community are really helping, and that's in terms of folks social distancing and not being out and about is making a big difference. And of course, we say that not to suggest that it's made a difference, it continues to make a difference, and so it's crucial that we continue to do those things.
Yes, can't repeat that message enough. In Ontario right now, it looks like about half of people who have been hospitalized end up in intensive care. Can you give us a sense of how you assess who to move into intensive care, what their symptoms are, at what point that you put them on a ventilator, just for those of us who aren't in that setting?
Sure. So when people are coming into hospital, the main symptom that they're expressing is really shortness of breath. That's what drives people to leave their homes for the most part and come into the hospital looking for care. And so when we're trying to determine what these people need in terms of hospital care, if someone requires oxygen, that's given through many different delivery mechanisms. So if you require supplemental oxygen through a tube that's in your nose or a mask that's covering your face, you might be able to just manage then on an inpatient bed, so be on a ward in the hospital. But if you're requiring higher and higher levels of oxygen so that those delivery mechanisms are no longer going to work for you, that's when we look at putting you on what we call a ventilator or a breathing machine. And what that really entails is sedating somebody completely and then putting a tube, we call an ET tube, down that person's throat into their trachea or their breathing tube or their windpipe, and then attaching them to a machine that's doing that breathing for them and allowing us to give higher levels of oxygen to that individual.
Dr. Nimji, what concerns you, worries you most about this virus?
You know, there's a whole host of things we're looking at. This is novel, so we don't have immunity in our communities, which is why so many of us are getting sick so quickly. There's still a lot that we don't understand about why some people get sicker than others. There's the things that we do know, for example, the comorbidities that you've heard about, people with pre-existing health conditions, but there are young people that are getting sicker than others. So why do some people have milder illness than others? Certainly there's a lot of anxiety and worry about lack of other treatments, this being so novel, and then not having a vaccine. And so the big question is, how do you safely start decreasing some of the measures, the tightness on the measures that we have in the community to allow some of that normalcy to come back as the weeks and months progress? And how are we going to know that we're doing that safely so we're not putting ourselves again at risk of a second surge, as we call it?
Coming up.
The issue for a lot of Canadians is that they have no savings.
Coming to grips with our new financial reality and
Why can't we go outside and play with friends anymore?
helping our kids understand why life isn't the same.
We know so many of you are struggling financially. Staying home sounds like a luxury, but it is not if you have lost your job and can't pay the bills or the rent or the mortgage. There is some government help on the way and lots of people will qualify for it. But the fact is, before this virus ever arrived, many Canadians were living well beyond their means. And now, as David Aiken explains, it's crunch time.
Canada has hardly ever been a nation of savers. Canada is a nation of spenders. And the choice by Canadians to be spenders, not savers, has left millions of Canadian households anxious and vulnerable in this once-in-a-generation crisis. For most of the last decade, we have been spending what we earn: new TVs, new cars, new homes, and if our earnings were not enough, we borrowed. And why not? Interest rates have been stuck at generational lows. Job growth had been strong, so strong that unemployment also touched generational lows. The COVID-19 crisis turned all of that upside down.
The issue for a lot of Canadians is that they have no savings. They live paycheck to paycheck. They might have a bit of money in the account that'll get them to the end of the month. But if they're off work for a month or two, they're in serious financial difficulty.
And that has put into stark relief another number that has hovered near generational lows: the national household savings rate. For the last decade, Canadians have barely saved 3.5 cents of every dollar of disposable income. 3.5 cents to the dollar.
There's always something that I need to pay for my business, some supplies to order, or an event like a market to pay for.
Megan Rose is self-employed, an artisan. She supplies boutiques and gift stores across Canada with what she makes, and her business has dried up.
So I've never been able to save money with my business. I also have a mortgage too, so just the high cost of running a business and the cost of living has never allowed me to save any money.
Indeed, almost 1 in every 3 Canadians, or 31%, say they have less than a week of savings or no savings at all to rely on. That's according to a poll by Ipsos provided exclusively to Global News. Just under 1 in 4, or 23%, say they have 2 to 4 weeks of savings, while another 1 in 5, or 20%, say they have between 5 and 13 weeks of savings to draw on. That partly explains why the federal government focus has been on replacing income rather than protecting savings.
I don't have any savings. I do have a good line of credit and credit cards, so I could go for probably several months using that, but it's not really sustainable.
Income was all most Canadians had.
Most of the folks that are going to be laid off are not making $100,000 a year or $150,000 a year and have a big savings account. Most of them are making $12, $14, $15 an hour. They have no savings. They live paycheck to paycheck.
And ironically, Canada may not now be able to afford to become a nation of savers. To speed and strengthen any economic recovery, Canada will have to spend. Spend on a meal out at a local restaurant. Spend on new clothes from a favorite retailer. Spend on a new home and all its furnishings. That's how Canadians will bring back the economy and put neighbors back to work. By spending, not saving.
You can see them in every Canadian neighborhood. Kids with their noses up against the glass, peering out at a world they no longer understand, wondering what happened to their lives. Parks and playgrounds are closed. The news is all about frightening stories of a mysterious virus and all the sick and dying people. And as Jeff Semple explains, children have lots and lots of questions.
There you are. Nice to see you. How are you guys doing?
We're doing good.
Yeah?
Like a lot of kids, Brianna and Bryson have been stuck at home for weeks, finding creative ways to pass the time.
We've been painting rocks. We got some right here.
That's cool. Hold them up. Let me see.
Those look great.
How does it feel being at home for so long?
I'm missing Grandma.
They're growing bored and a bit worried about this virus everyone's talking about.
They've asked a lot of questions and we've talked about it.
We know about that, the coronavirus.
Child psychologists say that's important.
Especially school-aged children do understand the severity of what is going on. I mean, their life has completely shifted.
How long has the new virus or
Global News asked kids to send us their top COVID-19 questions. Bryson wanted to know about his grandma.
My question was, why can't I hug my grandma anymore?
So we put his question and others to the experts.
If you were to hug your grandma or kiss your grandma or get too close to your grandma, you might be passing on the virus to her. And we know that people, especially grandmas and grandpas, usually get a lot sicker than maybe young people do.
In fact, most young people who've gotten the virus have done a great job fighting it.
How did COVID-19 start?
Experts aren't actually sure, but they think the virus started in a bat in China.
Occasionally, the viruses can pass from a bat to another animal, perhaps through a bite or some secretions from the nose of the bat. And then sometimes that animal will pass the virus to humans.
My question is, can COVID-19 go on other planets, and is COVID-19 on a hairbrush?
It's certainly possible. If you were to cough into your hand and then touch your hairbrush, the virus could pass from your hand to the hairbrush.
As for other planets, experts don't think COVID-19 could survive in space, but some coronaviruses can live in freezing temperatures for up to 2 years.
Hi, my name is Kristen. I'm 5. And how long would the germs last?
COVID-19's germs can survive on some surfaces, like a plastic toy, for up to 3 days.
The virus doesn't jump, so it doesn't go from a toy into your nose. The only way it can get there is if you touch it and then touch your mouth and nose.
What's your name? Foster. How many minutes are we going to be home, and how long can we go to our friend's house and grandma's house again?
Unfortunately, experts say it's not a matter of minutes, but weeks.
I do think that these physical distancing measures are going to last for at least another 6 to 8 weeks, if not longer.
Hi, Grammy.
But then, if everyone does their part, Bryson and his sister will get to visit Grandma again very soon.
We love you and we miss you so much.
Coming up, a glimpse into our new reality.
Normality will not come back until we get a vaccine for this.
And more sustainable future.
I'm hoping that this is a bit of a wake-up call.
Rethinking the way we work and socialize.
If someone had said to you in December that by April, millions of people all over the world would be infected with a mysterious new virus that has no vaccine, you'd think they were talking about a Hollywood script. It's happened so fast, it almost doesn't seem real. And it has everyone asking, when will it end? Jackson Prosco went looking for answers.
This is not normal. At least it wasn't until a few weeks ago, when everything we take for granted, everything, moved just beyond our grasp. 6 weeks ago, nobody worried about touching their own face or leaving their own house. Nobody thought about lining up to buy groceries. Now there are more planes on the ground than in the sky. Work has become a luxury for those who still have a job, especially for those who can work from home. And home is where most of us now spend our time, sitting and wondering how we get back to the world we knew.
We know that the mass social distancing measures will work. They will bring cases down. We've seen that everywhere they've been tried, and it stands to reason that if everyone stops going outside their house, that case transmission will slow considerably. The problem is you can't sustain that indefinitely.
Jeremy Konyndyk is an expert in pandemic preparedness at the Center for Global Development in Washington, D.C. He, like virtually every expert, has bad news for anyone who thinks there's an easy road back.
You need a plan B, phase 2. You have to pass the baton to a different set of protective measures so that you can keep cases low while actually having a functional economy again and allowing people to move again.
Few governments have such a plan. They're still dealing with an unfolding health disaster and a mysterious new virus. COVID-19 is stealthy and it's lethal. No one appears to have natural immunity. No one knows how widespread infections really are, or if the virus will come and go with the seasons.
The 1918 flu pandemic went on till 1920, so this could easily go on a couple of years, waxing and waning. And
Dr. Peter Hotez is a vaccine scientist at Baylor College of Medicine in Houston. He believes governments need a strategy for how daily life will operate for the next 2 years. Yes, 2 years. That's the length of time it could take to develop, test, and distribute a vaccine once the surge in cases is over.
Do you see us potentially getting to a place where restrictions and social distancing are loosened and then tightened up as localized outbreaks pop up?
yeah, that's a possible scenario, but how do you operationalize that, and how do you inform companies or universities when to stay open, when to close? And how do you get people to feel comfortable doing that, who might be terrified about resuming normal daily activity? So a lot of complexities without a lot of precedent.
The complexity is not lost on public officials anywhere. They've struggled to explain what a way out might look like.
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population.
I think even after we're through this first wave, we will need to remain vigilant and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this.
In South Korea, they've learned that social distancing is only half the battle. The government implemented an aggressive system of testing, contact tracing, public alerts, and quarantine to keep case numbers and fatalities relatively low. Even then, life is nowhere close to returning to what it once was. The virus keeps popping up. Other countries have begun to relax restrictions, only to experience a second wave of infection. Canada, the U.S., and Europe are still at step one, trying to contain the outbreak. And public health officials say they're nowhere close to being ready to think about anything else.
How are we going to get back to normal without higher levels of testing? Like, if people are walking around with this virus that don't even know it?
Right now, our focus is to tackle this actual outbreak. At some point in the near future, we will be looking at how do we apply serologic testing, for example, to look at the level of immunity in the population.
Even though everything shut down all at once, it may come back slowly, in waves, once the peak of cases is over. Perhaps restaurants and bars reopen with fewer seats inside. Schools could come next. Big concerts and sporting events are likely a long way off. Dr. Ali Muqdad worked to develop the pandemic models used by the White House.
So until we have a vaccine, our definition of normal should be totally different what normal is. So I don't expect all of us to be back to normal as 100% immediately, but in a staged approach to make sure the virus is not circulating and we don't allow this virus to have a second wave.
The risk is in coming back too fast. There's little room for trial and error when human lives are on the line. Dr. Lena Wen is the former public health commissioner for the city of Baltimore.
I don't think that you can lift it overall altogether and say, let's go back to exactly what our pre-COVID-19 days were like. That's not going to work because we know what the consequence is going to be. We're going to have a huge number of deaths and COVID-19 will spiral out of control.
Almost every expert agrees a vaccine is the fastest, safest way to get our world back, even if it means a year or more of waiting. Until that happens, we're stuck in a cat and mouse game with something that can't be seen or detected until it's too late. It may be the most painful wait of our lives.
So we're in this for a while.
We are. And it is a new normal that we all have to get used to, recognizing how difficult this is and how many sacrifices are going to be borne by everyone. But if we stop now, then these sacrifices will be in vain. And it will take much longer and many more lives will be lost.
All this virus needs is a human body. It doesn't care if it's a prime minister or a sanitation worker. But some in our society are at much greater risk than others. Those who don't have the luxury of working from home, for example, or live in confined spaces and can't physically distance themselves from others. Kai Chan has been thinking about how our society might be altered when we get through all of this. He's a professor at the Institute for Resources, Environment and Sustainability at the University of British Columbia with a background in science, policy and ethics. Kai, thanks for joining us. You know, a lot of people have talked about rethinking who is an essential worker and the value we place on jobs that now we know are such lifelines for us, like cleaners and grocery and agricultural workers, delivery drivers. What's your thought on that?
It's really clear who matters most in these times. It's also clear that a whole bunch of folks in our society are fundamentally dependent on working all the time, right? Like week to week. And it's a real problem that these kinds of interruptions to the daily lives mean that people can't pay rent, etc. And I think we need to structure our society in order to enable these kinds of events not to disrupt the whole economy and people's lives.
You know, how have the public health measures in place, the lockdowns, the physical distancing, made you rethink how we live, both in our work culture and our social culture?
A lot of people are anxious to get back to business as usual. And for me, I'm hoping that this is a bit of a wake-up call, that we're not going back to how things used to be, but rather moving forward, bouncing forward into a better future. One good example of that is the way that we work remotely with colleagues. I have a whole bunch of international meetings that I'm supposed to go to. And due to the coronavirus, we've been having to have those meetings online. And we're working through the really challenging aspects of trying to maintain that kind of social nuance that we have in face-to-face dealings through online media. It's not perfect yet, but hopefully we'll be able to bring in new technologies in order to make that work well for all of us.
But it is hard to imagine right now getting on a packed airplane, going to big international conferences, surrounded by people. Do you think we will actually rethink how business gets done, or we're social beings? Will we just revert to the way things were?
I actually think we will. At least in my community, in the environment and sustainability space, it's been clear for a long time that we need to start to rethink these things for climate reasons and for other environmental reasons. And we've just been kind of slow on it, just waiting for, the right push. Well, arguably, this is a really good push to force us to work through the difficult bits so that it starts to become normal, which it surely will before this thing is over, which unfortunately it's going to drag on.
You know, though, Kai, we are social beings, and maybe business can change how, it does business, but what about the connectedness between people we love? I mean, so much of that is shut off right now. That's not something that's just sustainable for humans, is it?
No, No, I mean, not the interpersonal day-to-day, it isn't quite the same. At least it doesn't feel that way yet, to talk to people at a distance of 2 meters or more. Maybe we will get somewhat used to that. I don't know. Probably not in the short term, but I certainly do hope that we can go back to being able to, hug our friends and shake hands again. It's going to be such a long time, though, before that happens, that, I think we will start to rethink pretty big decisions, like how far we are from family, for example. It's really pained me to see that my parents struggling through this time and having my sister to rely upon, but me not being able to help over there in Toronto.
Coming up, the new reality of the party. How quarantine is bringing out the creativity of Canadians. There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.
Well, many of us are stuck at home. One thing is keeping a lot of people busier than ever: social media. For some people, it's been a way to keep in touch with friends and family. For others, it's an outlet. If you haven't been impressed with the creativity coming out of self-isolation, well, as they say, you haven't been watching. Our Mike Armstrong has.
Now, we've all had phones with cameras up there at the top for a while now, and somehow we still film vertically. But there's something we haven't had until now, and that's a ton of time on our hands. I have a friend, for example, sharing pictures of his different sneakers. It's a little strange. But that same friend flagged this family having fun.
Standing in a crowded room and I can't see your face.
Now, I'm not sure how much skill went into making this video, but it's basically impossible to watch without smiling. Smiles are kind of the one infectious thing that's okay right now. Now, that video is one of thousands on a Facebook page called Ultimate Online Nova Scotia Kitchen Party COVID-19 Edition. The group started just 2 weeks ago and has ballooned up to include contributions from every corner of Canada and close to 100 other countries.
Well, welcome from sunny South Korea.
The organizer says there are a lot of people looking to avoid cabin fever. Or as she calls it, shack wacky. I kind of like it.
We have many different types of talent. We've got people who are literally just picking up instruments for the first time, people who are dusting off their old instruments, and we've even got some professionals in the group, which is pretty cool to see.
There are a lot of parodies out there right now. Disney's a big inspiration. Hard to believe this isn't the original.
Out on the streets you cannot play, cause you must stay 2 meters away. Self-isolation helps save the nation in quarantine. We hear of theories how it grew. From snakes and bats became a flu.
There are some new takes on some old classics. And there was no way I was leaving the Bare Naked Ladies out of this.
Do I have the COVID virus? Have you traveled outside of the country? Do I have the COVID virus? Your temperature more than 38 degrees.
Now, some have taken the inspiration of this infection and created the sort of music that gets into your head and refuses to leave.
We're staying strong and getting along, cause that's just how we do. Won't let this virus divide us, so try this with your family too. Lock the door, hit the floor. It's the family lockdown boogie.
If it's a Canadian toe tapper you're after, they're out there. How about the Prime Minister on wearing masks?
To prevent you from speaking moistly. Speaking moistly. Keep 2 meters apart. Speaking moistly.
And I don't know if banjos and auto-tune have ever been used together before, but it works for Alberta's premier talking about hoarders.
There must be a special place in hell, a special place in hell, a special place in hell for people like that.
Sticking with Alberta, the orchestras in Calgary and Edmonton set aside their hockey rivalry and recorded on their phones a very familiar tune. Unfortunately, it really makes me miss hockey. Some of us don't find it quite as easy as this Ontario family to occupy our time. They recreated the entire Simpsons opening. Maybe skill isn't absolutely essential when it comes to spreading smiles. It helps if you can hold a tune or know a specific dance, but you can be contagious in a positive way just by being positive.
One person who has lived through countless ups and downs and always endured is Queen Elizabeth II. Her rare broadcast to the nation and the world recently was watched by millions. She talked about strength and patience and kindness until better days return.
We will be with our friends again. We will be with our families again. We will meet again.
We'll meet again. Don't know where. Don't know when.
That's a reference to a song by Vera Lynn, familiar to a young Princess Elizabeth and millions in the Commonwealth during the Second World War. An old song that has new meaning today. I'm Dawna Friesen. We'll be back in 7 days. For now, good night.